Hello, my name is Sakina Evans, and the title of my article is Exploring the Complexities of Suicide Among Black Women. What's the T? Um, Very quickly, my actual research area focuses on the superwoman schema and African American women in behavioral and outpatient mental health because I am a therapist. And around September, it was brought to my attention while I was out doing some presentations for Suicide Awareness Month with different Greek organizations that a very prominent young lady in our community actually lost her life to suicide. Um, for everything that was shared with me in her memory, she seemed to be very much so aligned with the superwoman schema in her life. And that's kind of what promoted the idea to focus my article here, to just do something different but still align with the superwoman schema. So, as we begin, this presentation focuses on myths, trends, and critical factors shaping suicide among African American women. This is a deeply overlooked yet urgent topic, as myths about resilience and the strong black woman archetype often obscure the real struggles that African American women face, which impact their mental health. Research shows that these cultural narratives can create silence to vulnerability and limit access to effective mental health support. So, to fully understand the weight of this issue, we must first explore the historical and cultural background that has shaped these myths and trends. And by unpacking those, we look at the intersection of systematic inequities, cultural stigmas, and historical trauma. We can begin to see why addressing these myths is a vital step towards improving mental health outcomes for African American women. So let's dive into the background a little bit of this work. Suicide rates among African American women have actually steadily increased over the past 2 decades, with a significant rise in younger age groups from 15 to 24. Those climbed from 1.9 to 4.9 per 100,000 people in 2020. And this trend reflects unique stressors faced by African American women, highlighting the urgency of targeted interventions. Most of us know there are a lot of cultural stigmas around mental health that contribute to the underutilization of mental health services by African American women. Growing up, a lot of us were taught that, black people don't kill themselves. And we were taught that, black women have to be inherently resilient and strong and perpetuate a lack of acknowledgement in the true mental health struggles that come with carrying that load sometimes. When we look at the intersection of systematic barriers, structural racism and socioeconomic disparities and a lack of culturally competent care significantly limit African American women to access effective mental health support. And this can be compounded by other factors like intimate partner violence, neighborhood violence, limited investment in mental health resources within their communities. And these societal stressors, including racism and misogyny, disappropriately impact African American women, which leads to high causes of anxiety, depression, and suicidal ideation. So, why do we need research and advocacy in these areas? It's to combat these trends. There's a pressing need for culturally sensitive research and policies that address these disparities, and tailored interventions can dismantle stigmas, improve access to care, and create community based solutions to reduce the risk of suicide among African American women. African American women experience unique challenges in addressing mental health issues and preventing suicide. My research aims to explore how cultural, social, and systematic factors intersect to influence mental health outcomes. And central to this discussion is the pervasive impact of the superwoman schema or strong black woman schema, which is a cultural myth that often discourages vulnerability and help seeking behaviors. What the research shows is that this stereotype can contribute to emotional suppression and increase mental health risks such as depression and suicidal ideation. And so, to understand these trends and patterns, there's a growing body of research highlighting alarming trends in suicide rates among African American women. For example, between 1999 and 2020, the suicide rate among African American females from 15 to 24, it more than doubled. And African American women still remain underrepresented in both research and prevention programs, leading to a data gap that undermines effective policy making and interventions that really cater to those mental health challenges that African American women see. And so, one critical focus of the article is to challenge myths and stigmas surrounding African American women and mental health. These misconceptions often stem from societal pressures that we have to appear to be strong, we have to be unbreakable, we have to carry loads on our backs, which, does not help in expressing emotional struggles. And so, by debunking these myths, I hope to foster a cultural shift towards acknowledging and addressing mental health needs, specifically with suicide trends within this particular demographic. Another emphasis of the article will be to promote culturally tailored interventions. And so those are so important. For instance, integrating community based support systems and peer led groups and spirituality into mental health practices, which we traditionally do not see, but have been proven to be effective and resonate with African American women when we look at challenging systematic racism in places like healthcare and the work environment, and these things that often impede access to quality mental health services. So, as far as targeting journals and selection rationale, for this research, it's essential to target journals that specialize in mental health, social work, and public health with regards to African Americans and whomever else may be interested in studying this particular information. One journal that I've looked at is the Journal of Black Psychology. It seems to prioritize studies on mental health and the resilience of Black communities. It also supports a lot of articles that focus on the strong Black woman syndrome or superwoman schema and exploring systematic contributors to mental health challenges. Another journal is the Social Work in Public Health. That platform discusses a lot of social determinants of health, and they talk a lot about intersection with African American women's mental health, and it's particularly aligned with exploring community based and policy driven solutions in mental health disparities. And the last one that I looked at was the Health and Social Work Journal. That journal emphasizes a lot of culturally competent practices and practical interventions, which make it an ideal fit too to share recommendations that other professionals may be able to directly benefit from. And so when I look at steps in the submission process for most of these, it's preparing, a manuscript that adheres to APA with specific word limits and ensuring that my submission is on platforms that kind of streamline the process so that I can review the peer review process, which I hear can be pretty lengthy. Um, and so I know that's necessary to ensure that my article is assessed objectively and that it is robust and rigorous and all the things that they seek when they are accepting articles for submission. And one of the other things that I looked at was understanding how data is interpreted and how actionable recommendations are looked at, because I feel like those both influence scholarly discussions and real world practices. And as I conclude, I just want to say that it's essential to reflect on the significance of the research. African American women face unique cultural challenges that intersect with mental health outcomes, and that includes myths and resilience and underaddressed suicide trends. The research that I've seen highlights the urgency of addressing disparities with culturally competent interventions. One of the noted references, Morris et al., says that dismantling myths is crucial to improving the visibility and accessibility of mental health services for African American women. And furthermore, I hope that, you know, other inequities such as healthcare and cultural stigma that exacerbate these suicide trends can be looked at. So, for me, the next steps is to just continue gathering information and looking at research to refine my writing process and the manuscript based on the specific requirements of the journals, and talking with other peers to strengthen my research and further ensure that it's going to be looked at as something applicable and practical in settings. And this research isn't just an academic exercise, but in a lot of ways a call of action to challenge myths, amplify voices of the women that have already been lost, and advance equity in mental health care. Um, Researchers, practitioners, advocates have to continue to elevate these critical conversations and push for systemic changes that center the well being of African American women. And in hopes of doing that, hopefully, we can foster a mental health landscape that's inclusive and culturally informed and accessible to women so that these rates of suicidality in the African American community don't have to continue to rise.